Foundational basics. The four very important words when you're doing any kind of biomechanical or lower extremity analysis are pronation, supination, varus, and valgus. Pronation. Pronation typically unlocks the joint. It internally rotates the tibia and the femur. Knee flexes and moves into valgus. And excess leads to fatigue injuries. So those are your tendinitises. Supination locks the joint. It externally rotates the femur. The knee extends and moves into tibial varus. Excess leads to stress injuries like medial tibial stress syndrome. Essential components of the gait. There are three. There's contact, mid-stance, and propulsion. In contact, the subtalar joint pronates for shock. In mid-stance, the subtalar joint supinates, and this creates a more stable platform, and in propulsion, the medial weight shifts the first ray into stabilization. In forefoot varus, this patient is demonstrating the inverted forefoot, so the big toe is up. It's compensated with a high arch, increased supination, and increased stress injuries. An uncompensated forefoot, inverted forefoot, or forefoot varus would be calcaneus everted. The subtalar joint pronates, and then you have your fatigue injuries. With forefoot valgus, so it's an everted forefoot, the pinky toe is up, as demonstrated by this patient. And uncompensated compensated is pretty uncommon. Compensated increases supination and increases stress injuries. This particular patient also has claw toes along with his increased supination, so he has a multitude of issues. Next is rear foot varus, so this patient is demonstrating an inverted rear foot. The calcaneus is pointed in. Compensate, it increases pronation and increases fatigue injuries, and uncompensated causes it to be pronated and increases the stress injuries. This person is compensated. Rear foot valgus. It's actually very uncommon. I couldn't find one in my practice to show you a picture, but the rear foot is everted. A compensated one is really, really uncommon. An uncompensated one causes more pronation, decreased stability, and increased fatigue injuries. Tibial vera, and I thought this was a good picture since most babies have this at some point in time, is a bowed leg. And as you can see with this tibial vera, the subtalar joint pronates, so it rocks in and the calcaneus is perpendicular to the floor. This table kind of sums up what was discussed in that first bit and kind of gives you an idea of what is going on as far as with pronation and supination.